Welcome to the 3-Minute Read podcast. I'm John Dalton, editor of the twice-monthly newsletter of the Healing American Healthcare Coalition. Joining me once again is Ed Eichhorn, the coalition's co-founder and co-author of Healing American Healthcare, a plan to provide quality care to all while saving $1 trillion a year.
Good morning, John. Good to be with you again.
Thanks, Ed. Together, Ed and I have nearly a century of healthcare experience, and we're still trying to figure it out. It's really complicated. You can find our background and contact information at the end of the podcast. Ed and I launched the 3-Minute Read in March 2020 to summarize some of the critical issues affecting busy clinicians and physicians as they struggle through this pandemic. Today, we're here to discuss the 30th issue of the 3-Minute Read. So let's dig in. As you can see from the contents, we summarized 6 articles in April's second issue. The first dealt with President Biden achieving his goal of 200 million vaccinations in his first 100 days. And that was followed by 3 articles describing some of the pandemic struggles in India, Brazil, and Hungary. I will discuss those articles, and then Ed will follow with some clues as to where telehealth is headed and a glimpse at the adverse impact of treatment delays that have been happening during the pandemic. So let's begin with Biden says goal of 200 million COVID-19 vaccinations in 100 days has been met. And this was published April 21st, written by Brian Naylor of NPR, National Public Radio. He announced that Americans have received 200 million vaccinations since he took office. That's double his campaign's initial goal of 100 million in his first 100 days. Happily, 80% of Americans over 65, including Ed and I, have received at least one shot. We've both been fully vaccinated. More than half of all adult Americans have received at least one shot. All Americans 16 and older now are eligible to receive the vaccine. So, Biden also announced the availability of tax credits to employers who give their workers paid leave to get a shot. What he said was, quote, no working American should lose a single dollar from their paycheck because they're doing their patriotic duty to get vaccinated. So there's a lot happening. This is actually about 91 days into his first 100 days when we hit the 200 million mark. When Biden took office on January 20th, on that day, 4,380 Americans were reported dead from COVID-19. Throughout April, the deaths are down to about 750 a day. On January 20th, 16.5 million doses had been administered since December 14th, when the first dose was administered to a nurse in Queens, New York. Since then, as of today, there are 237 million doses that have been administered. So the good news is that cases, deaths, and hospitalizations all are declining. There's more needed to be done. So our take on this article is that Biden made a promise, and that promise has been kept. Also, the administration, this is from the detailed article, is calling for employers to incentivize their employees to get their shots. So that includes by giving them discounts and through product giveaways. There's a survey that indicates that nearly a quarter of Americans who do not plan to get vaccinated, these are the people who are hesitating to get the vaccine, they say they would if they got paid leave, gift cards, cash bonuses, or other incentives. Well, that's happening. I saw some articles this week, one this morning from Modern Healthcare. Cigna, the major health insurer, is offering employees $200 to get vaccinated. West Virginia is giving $100 saving bonds to young adults who get vaccinated. In Cleveland, Krispy Kreme is offering a donut a day to folks who get vaccinated. And in some states, marijuana dispensaries are offering joints for jabs. The next 3 articles really talk about some of the challenges that still remain in the pandemic. This was the front page, first lead article in last Sunday's Times, and that picture that you see below is what grabbed my attention. It was a lengthy and detailed article titled, As COVID-19 Devastates India, Deaths Go Undercounted, by 4 journalists. Jeffrey Gettleman is chief of the Times Bureau in New Delhi. And the scene you see below is crematoriums burning bodies. India began with a harsh initial lockdown last year and seemed to have the pandemic under control. Unfortunately, now a second wave is ravaging the country with over 300,000 new cases daily. And hospitals are running out of oxygens and capacity, beds. Many experts doubt the accuracy of India's official COVID-19 death toll of nearly 200,000. And let's look at some of the reasons why. For example, University of Michigan epidemiologist Balmir Mukherjee has been following the situation closely. He's an India expert. Quote, from all the modeling we've done, we believe that the true number of deaths is 2 to 5 times what's being reported. So that would be a range of somewhere from 400,000 deaths to 1 million deaths in a country of 1.4 billion people. Now, cremations are an important part of Hindu burial rituals. Cremations are seen as a way to free the soul from the body, and crematoriums throughout India have been backed up with demand for cremations exceeding their ability to do so. The Times journalists did interviews with staffs at crematoriums throughout the country, and in most cases, the common thread was, we've never seen so many people dying so quickly. They confirmed, though, that in most cases, they're instructed to put bimari, which is sickness in Hindi, on the death certificates. Now, this runs completely contra to the World Health Organization's instructions to all of its member countries, that death be recorded as COVID-19 related if the disease is assumed to have caused or contributed to it. And for many of these cases, these are people who died from COVID-like symptoms. So clearly the deaths are being undercounted and the disease is ravaging India. Now, politics has entered the equation. Some states controlled by Prime Minister Narendra Modi's party may be facing pressure to underreport. Back in 2019, his government tried to suppress data showing increased unemployment. So there's the political pressures to not report deaths as COVID-related. And either way, it's a tragedy, and the devastation is raging even as we speak. What's most troubling is that India's runaway surge is also being driven by the emergence of a double mutant, and that's particularly troubling. One part of that mutation is like the South African variant, which is highly virulent. The other is like the variant that raged through Southern California a few months ago. So its combination is both highly transmissible, so it's highly contagious, and it's more virulent than the variants that we've been fighting. So India is in deep trouble, and hopefully we'll come out of that soon. Brazil is another country, part of the developing world. I think most of us have heard the term BRICS, B-R-I-C-S, over the years. That's Brazil, Russia, India, China, and South Africa. Those are considered to be the major large countries that are developing but not part of the fully developed world. So Brazil battles coronavirus with a Chinese vaccine. Even the Chinese concede could be better. This article is in the Washington Post, April 15th, written by Heloisa Triano and Terrence McCoy. Brazil has been using China's coronavac vaccine to inoculate its population, but they only learned recently that China is considering changes to its vaccines to, quote, solve the problem that the efficacy is not high. The vaccine is 78% effective in protecting against moderate and severe COVID-19 cases, but only 50% effective against all cases. The attempts to control COVID-19 spread throughout Brazil have been undone by political divisions, governmental ineptitude, poverty, and apathy. And over the last several months, we've seen occasionally highlighted in the news various parts of Brazil, Manaus, Sao Paulo, Rio, where the disease has been raging. Brazil now is losing about 3,000 lives daily, similar to India, and new variants are storming the country. Brazilian President Bolsonaro has been skeptical of all vaccines, so that hasn't helped. That's adding to vaccine hesitancy among his population. Some of you may remember Bolsonaro's visit to Mar-a-Lago, March 7th, 2020, brought with it the COVID virus, and several of the members of the Brazilian delegation came down with it, as well as many of the folks who were at the Mar-a-Lago event. The next week is when we went into our lockdown. Now, Chile has vaccinated more people quickly than any other country in the Americas. It's been using China's coronavac vaccine, but their cases have been surging, which leads to questions over whether the vaccine is as effective as desired. Like I say, 50% effective against all cases, so there are a lot of breakthrough infections. However, there's one city in the southeastern part of Brazil, Ceará, which had been ravaged by COVID-19, but by the time this article was published, all adults have been vaccinated, more than 27,000 people. So in recent weeks, as the vaccine reached more people and statewide restrictions took hold, confirmed monthly cases in Ceará were reduced by more than half. And then the lines of people waiting for ventilators at hospitals vanished. And 10 days went by without a single coronavirus hospitalization. So the bottom line is that even though the vaccine is only partially effective, it does help reduce infections, cases, and deaths. The third article in the series is from Hungary. This is from April 1st. Hungary, despite having one of the world's worst per capita death rates, plans to ease restrictions. And Ben Novak of the New York Times wrote the article. As of March 31st, Hungary's fatality rate of 214.7 per 100,000 was exceeded only by the Czech Republic among the OECD's 37 members. However, after a month of lockdown measures to combat the virus, Prime Minister Viktor Orban moved to reopen society. Quote, infections are widespread and lockdowns or curbs can only slow the spread, but they can't stop them, Mr. Orban said. Mass vaccination, in his opinion, is the only way to bring the suffering to an end. So he downplayed the death toll and the impact that it was having on the nation's struggling hospitals. Unfortunately, the independent news media in Hungary is not permitted access to hospitals, nor are healthcare workers allowed to speak with journalists on the record. But healthcare experts argue that the high death rate has been made worse by the broad structural mismanagement of the government response, and that's been compounded by the burdens placed on a health system that is sadly and grossly understaffed. So our take, sadly, the Brazil, India, and Hungary articles illustrate once again that when politics trump public health, people perish needlessly. Ed, on to you.
Thanks, John. The next article that we'd like to talk about is entitled Prospective CMS Administrators Confirmation Hearing Highlights Congress's Desire to Expand Telehealth Coverage. It was written by Nick Hutt of the Health Finance Management Association and appeared on April 21st. In the confirmation hearing for Chiquita Brooks-LaSure, the nominee for CMS Administrator, it became clear that telehealth will be a key part of Medicare and Medicaid policy. Senate Finance Committee Chair Ron Wyden, a Democrat from Oregon, said during the hearing, as a result of the pandemic, we've removed some of the roadblocks for people to actually get a telehealth provider. We're going to have to make these kinds of changes permanent in addition to working on the critical reimbursement issue. Other committee members, including Ranking Member Mike Crapo, a Republican from Idaho, echoed his comments, noting that it is an area of potential bipartisan agreement. Senator Crapo is also concerned about reducing the cost of drugs. He believes it's important to do so, but in doing that, he believes we should maintain the independence of pharmaceutical companies and their interest in developing new drugs and treatments for future diseases. Other policy areas that were discussed during the hearing included surprise billing, prescription drug pricing, and the impact of deferred care caused by the pandemic. Senator Robert Mendez, a Democrat from New Jersey, cited a study showing primary care visits declined by 21% in the second quarter of 2020 when compared with the previous 2 years. Our next article actually builds on what Senator Menendez was concerned about during the hearing. The title of this article is From Rotten Teeth to Advanced Cancer, Patients Feel the Effects of Treatment Delays by Bruce Albert of the Kaiser Health News, and this was published on the 20th of April. He reported that as vaccinated Americans resume routine medical care, doctors and dentists are seeing the realities of pandemic-delayed prevention and emergency care, along with the stress that's related to ailments they are finding in more advanced cancer and cardiac disease and rotting and damaged teeth. Several specialties were quoted in the article, and we'd like to cover several of them with you because it tells you the magnitude of this problem in preventive and emergency care. The first we'd like to point out is from Dr. Brian Raw. He's the chair of the cardiology department at Montana's Billings Clinic. He was concerned because some patients arrive hours after feeling chest pains because they were afraid of contracting COVID-19 by going to the hospital. He said, for a heart attack patient, the first hour is known as the golden hour. From another perspective, a Detroit pediatrician, Dr. Gerald Mosby, points out that his young patients are suffering more stress, more depression, and weight gain when compared with times before the pandemic. And an Arkansas optometrist, Matthew Jones, is seeing much more eye strain because people are spending so much time in front of their computer screens. We also would like to share with you that Dr. J.P. Valen, the Chief Clinical Officer at SCL Health of Colorado and Montana, said that he is kept awake at night by delays in important medical tests. He said people put off routine breast examinations, and there are going to be some cancers hiding that are not going to be identified, potentially delaying intervention. He also expressed his concern that patients with appendicitis symptoms, like abdominal pain, fever, and nausea, aren't seeking timely treatment. A burst appendix involves more risk and a longer hospital stay than treatment when the pain and the fever currently appear. And there's also a recent American Dental Association survey that found more than 70% of member dentists reported an increase in patients grinding or clenching their teeth since COVID. More than 60% report an increase in other stress-related conditions such as chipped and cracked teeth. We also know that some providers report returning to pre-COVID office visit levels, and others still face COVID resistance. Dr. Gupta of the Gupta Gastro in Brooklyn and Far Rockaway, New York, has said, our patients are still avoiding getting the care they need, no matter the safety precautions that are in place. Our take on this is that until America achieves herd immunity, many patients will continue to defer care, likely resulting in higher mortality rates, longer hospital stays, and billions in additional costs for our healthcare system. So it's extremely important for each of us to go to the doctor when we need to, either for a normal exam or because we have some healthcare concern that should be addressed.
Thank you, Ed. According to the CDC's data, as of yesterday, 237 million doses of vaccine have been administered to Americans, but that's still not enough. While the U.S. appears to be winning the vaccine versus variants race to recovery, it's still too soon to declare victory. We've seen evidence now that vaccine supply is exceeding demand. We're now administering about 2.5 million doses a day. That's down from well over 3 million over the past couple of months. So millions more of our adult Americans need to be inoculated in order to reach that herd immunity. Whether it's a joints for jabs, paid time off, or a Krispy Kreme donut a day in Cleveland, keep those shots happening so that America may be able to declare independence from COVID-19 on July 4th. Thanks for listening. Please take a moment to complete our brief survey to let us know your thoughts on the future of American healthcare. In future podcasts, we'll share feedback on issues that include universal healthcare versus Medicare for all, the Eichhorn-Hutchinson All Care Plan, prescription drug pricing, and telehealth coverage. If there are issues of particular interest that you would like to see covered, please feel free to contact us. Here's our contact information, and between now and the next podcast, wash your hands, watch your distance, and even if you're fully vaccinated, please continue to wear a mask indoors. And if you want to join our mailing list, text HEAL Healthcare to 22828 to get started. See you next time.